Hey guys, welcome back to my channel. It's Effie. In today's video, the topic is total knee replacements. And if you guys have been subscribed to my channel for some time, you know that I've shared my journey quite a bit. When I got a total knee replacement at the age of 29 back in 2016, throughout the past 5-6 years, I've connected with a ton of people. However, not many around my age or quote unquote young who've gotten a total knee replacement. So it's nice to bring someone on this channel who's around my age. And I actually connected with Raven on Instagram. I found her randomly, just like I found many others that I follow. And Raven, I just have to say that, not to sound like a creep or anything, but the picture that I do remember when I first started following you was when you were wearing this really cute outfit and you had like your knee scar showing and everything. And you kind of talked about your journey. And I'm like, wow, this girl is so inspiring. And I know many people may have a problem with the word inspiring or inspired, but for me, when I see someone who motivates me or inspires me, I remember that person. And so that's why I wanted to bring you on this channel, because you just exuded such confidence and your outfit was so cute. And I was like, I need to be like that girl, because it's sometimes after you have a surgery or you have a scar, you don't really want to show that, and like you might feel like embarrassed or like shy to like wear shorts or skirts or whatever. So we'll get into that. But I just want to have people get to know you a little bit, share kind of like what led you to get total knee replacement. Obviously, we know it's rheumatoid arthritis, but sort of kind of like what led you to that, because everyone has a journey leading up to the procedure, right? So yeah, let's start with that.
I was in a lot of pain. I couldn't walk. I was wearing this knee brace for months after months after months. And I went to go get, I want to say an MRI, and they told me I was bone to bone. And it's crazy because the first thing the doctor told me at that time was like, oh, you need a total knee replacement. So I'm like, okay. I think I was only 26. So to be honest, I didn't do any research, which I should have at that time, but I was young, I didn't know. So the doctor at the time told me, oh, you need a total knee replacement. So immediately I was like, let me find a doctor who will approve me to get a total knee replacement. The first doctor I found was like, no, you're too young. Let's find more ways to figure this out. And to me, just being Raven, I was like, oh, he's not what I want to do. Let me find someone else. I found another rheumatologist who did approve the knee replacement. And from then on, smooth sailing, I got the procedure done. So yeah.
Yeah, that's kind of like similar to my story a little bit where, when I first started having signs of damage, the rheumatologist I was seeing at the time was like, oh, you're too young to get a total knee replacement, even though they saw that it was like inflamed and like obviously like starting to bend, because I had a contracture where like I couldn't straighten my leg like fully, but eventually got worse and worse and worse to the point where I was like limping, needed like assistive devices. But back then that guy was like, oh no, you're too young to have a procedure. Like that's not even on like the table as an option. I'm like, okay. And I even had to beg him at the time to like give me a cortisone injection. I almost just like took the needle and did it myself. But eventually I found someone way better. But that guy did what he needed to do for me. He got me on methotrexate and all that. It's a long story, but he just wasn't like really like action oriented. So the guy that I ended up seeing, the first thing he said to me was like, before I do anything, I want you to go see an orthopedic surgeon. So that was like my first meeting with him. That's like the first thing he said. And so then I went and saw an orthopedic surgeon because like I didn't know what was going on with my knee. It was like I was living in like a twilight zone at that time. I don't know like why I didn't act on things. But regardless, this guy was like, yeah, you have like a bone on bone. I did the MRI, x-rays and whatever. But this guy, I guess he specialized in younger cases. And he was like, yeah, the youngest person I did was 21 years old and she went off to college like a few months ago. So I was like, wow, so that was kind of like a blessing to have like a surgeon who would do some like the procedure on someone so young. And I'm sure you probably felt the same, like you were like, oh, this is awesome. Like you didn't have to go through like the hoops and like challenges that some people do even with finding a rheumatologist. It was like just quick and
it was quick.
Yeah.
And it's crazy because everyone who I came in contact with for this process, therapists, orthopedics, surgeons, everyone told me I was their youngest client. It was like, you're the youngest person I've ever did this surgery on, or you're the youngest person I had in rehab. So I'm like, oh, wow. Like, should I be honored? I don't know. I didn't know.
Right. It's awkward. Yeah. How did you respond to that? Were you just like, okay, or like, I mean, what are you supposed to say, really, right, at that time? But I'm sure, did you feel like bad when they said it, or like you just said, you weren't sure how to feel, you know?
Sure, because I'm like, everyone's telling me I'm the youngest, but it's like I'm bone to bone. I'm in pain.
Yeah.
What do I do at this time? But it's crazy. Did you know? I didn't know at the time until after my replacement that there were gel inserts you can get injected into your knee before the knee replacement.
Well, tell us a little bit more about that because I don't even know what you're talking about. Okay, because I'm interested.
Okay. So you want to know now?
Yeah, yeah. Go ahead. Yeah, sure. Yeah.
So after I got my replacement, after the rehab and everything, I met someone and she told me, she was like, hey, you're so young. Why didn't you get the gel inserts? And I'm like, what are you talking about? And she said, right before your knee replacement, they were supposed to ask you, is gel inserts it's kind of like a cortisone shot, but they insert gel into your knee where your bone into that cartilage area. And it lasts maybe for like a year and a half. So you don't have to get a knee replacement. And I was like, are you serious? Like I could have gotten that? And she was like, yeah. So then after that, I brought that up to my rheumatologist and she was like, yeah. So I'm like, why didn't you inform me? I could have did this instead of this whole surgery. But she told me her reasoning was because I was completely bone to bone. So she's like, you needed like a small, tiny gap, and I didn't have that gap. But I'm like, it would have been nice to at least have known. So yeah.
Oh gosh, I hate when you end up finding out things from like people and it doesn't come from like you know like your doctor or like whatever, you know. And so I had the similar problem like bone on bone, but my surgeon was like, I wish you came to me sooner because it would have been easier if you had something to work with, you know.
Right.
And I was like, well, I wish I came to you sooner too, but I mean, I can't go back and change the past. So, you know, but
Right.
I found out too, like it's best to have a little bit of cartilage so the surgeons have something to work with and your outcome can be a lot better. So I didn't know about that. Do you know the name of those gel inserts or are they just called like gel inserts? Like, I don't know.
I did Google it, and I think I just Googled gel inserts before knee replacement, and information did pop up.
So it's like a outpatient procedure then. They put you under, I'm sure, and they insert the gel. Oh, okay. Yeah, you know, and also like I was talking to some like medical providers and they were saying sometimes it can be different for people who have like an autoimmune, auto-inflammatory form of arthritis when it comes to those type of things because you know, like the joints attacking. So sometimes like things like that may be rejected too, you know. So that's kind of like why maybe sometimes doctors don't tell us about those things because it's like a different nature, you know. It's not just like osteoarthritis or like sport arthritis, right? That people get when they age or from an injury. So I think that also plays a big role because I know I was looking into like stem cell therapy. I did like some plasma PCP thing before my surgery, which made it worse. So I don't know if you tried like, did you try any like alternative things? I mean, obviously you didn't try the gel thing, but did you try like acupuncture or anything else before the procedure to kind of help your process of rehab, whatever?
I didn't, and that's one thing because I didn't know too much information. I didn't do any research. So I just listened to the doctors. They said, oh, surgery, surgery, rehab, rehab. And I did exactly what they said. And so now that I'm older, I've met more people, connected with more people. It's like, oh man, it's a lot that I would have done differently, but it is what it is.
You're right. So did you do the surgery right away or did you wait some time?
I did it
immediately. Okay. I was the opposite. So I saw the surgeon in February and he was like, you can do it tomorrow, but obviously you have to do like the pre surgery stuff, right? You have to get cleared. So I was just like, I'll wait. And so I waited till that July. So yeah, I postponed a little bit, but I did like massage and acupuncture and kind of like a little bit of physical therapy beforehand. But the PT was like, yeah, you don't need to come see me anymore. There's nothing I can do for you. So you know, I had to get myself like mentally prepared, but also like physically a little bit. But that's because I knew like I was doing these things before. So, but I don't know if that, you know, if it helped or not, you know, it's hard to say, but I think it did a little bit. How was like your recovery and stuff and how's your knee now? You know?
So recovery, it really wasn't okay. It really wasn't hard. It was challenging at times, but the times were because the stiffness. So my surgeon told me to make sure I move every hour on the hour so it would not get stiff. So to me, that was the hardest part because it's like you're not in pain, but that stiffness pain is what gets me. So it's like it was hard for me to go to sleep. And then when I was able to go to sleep, it's like, oh, you gotta wake up and try to move your leg. Oh, you gotta get up and use the restroom. So it was like that stiffness was like the worst for me. I did not like that. As far as therapy, it was very easy. It did hurt, but it was easy. And I'm glad one person that I know told me to take therapy serious because I know sometimes I like to shortcut stuff, like here, if you can get it over with. And she was like, no, Raven, make sure you do everything full out, stretch your leg, extend your leg, because you don't want to be like me where I wasn't doing what I was supposed to, and now I can't fully move my arm. So because she told me that, I made sure I did everything I was supposed to do in therapy. I think my therapy lasted maybe, I want to say I started therapy immediately the day of surgery. Right when I woke up, they had me walking up and down the halls. I want to say I had it 6 weeks at the house and then maybe 4 or 5 months at a facility. So that part wasn't really hard. It was just more of the stiffness trying to overcome that part. What about for you?
Yeah, so like were you in like the hospital for a while, like a few days, or did they try to kick you out fast? Because I know when I woke up, they had you they have people like try to walk up those little steps. I don't know if they did that for you, but I didn't make it that far because my knee was just like really swollen, so I didn't get to do that part. But I mean, for me, like they didn't push me too hard in the hospital just because my knee was more sensitive. So they were actually watching if I had an infection, which I didn't. God forbid. But it was just kind of like I needed to like take it easy. So I think they were trying to push me, then they realized like, no, she can't. And like the pain meds made me nauseous. So I
Yes.
was like, I gotta relax. Cause like one time the nurse and like the PT was there and they were like, oh, she's probably just nervous. I'm like, no, I think I'm going to throw up. And then they were like going back and forth with me. I'm like, I need to sit down. They're like, no, I think you're just nervous. I'm like, no, I need to sit down. And then after that moment, they're kind of like laid off me. But I don't know if you use that like CPM machine at all. They had me use that one day and then they were like, no, this is making her knee worse. So we stopped. So I just like did gentle things. And then like I was there for like 5 days. I did mine during the 4th of July weekend, which I don't know why I chose to do that. Like again, like I was supposed to do my surgery the week before that, and then I postponed for some like legit reason. And then I ended up seeing the fireworks through a really nice suite window. So that was cool, but never again. I'll never do a surgery, never say never, but I don't want to do a surgery during a holiday if I don't have to again. So, but
I was in for 5. Everyone I spoke with actually stayed overnight. I was in and out. I know they were
oh,
tired. They wanted me out. I could not. I was very sleepy after I woke up, and I want to say my surgery was over maybe like at 9 or 10 that morning. It was 2 p.m. They're like, Raven, you have to get up, wake up. I was just so tired. So they forced me to get up. They forced me to walk. And then after that, I went home. But I was in a lot of pain, and all the medicine they did prescribe wasn't working. So they told me in order for them to get me out of that pain, I had to go back to the hospital and stay there for a couple of days because the medicine they had to give me had to be injected through an IV. And I was like, oh no, I'm not leaving this house. So I just stuck it out.
oh wow. Okay, yeah, because they like gave me like they gave me that medicine, but it was like something attached to your leg, and then it was like a pump for me. So it was
Oh,
like a thing that you would like press, and it would insert the medicine
oh,
for you.
okay.
Yeah, I don't know. I guess every hospital's different, every state's different, but I also heard about like there is like a female knee replacement. I don't know if you heard about that too. But where like they mold it to be more for like the female body. And I was like, I
No,
wish I knew that because I don't know if mine's too bulky, like I was like, come on.
I'm big and huge compared to. Oh, that's fine. That's fine. What's the CPM? Is that like the vibrator machine that's on your knees, your
Um,
legs?
no, it's like you sit in it and then like it's a passive motion machine. I'll try to like put some pictures up here if I edit it, but it's like yeah, you like lay down on your back and then your leg and your knees like in this little furry thing, like this, I don't know, they put some type of pillow, whatever. I don't know how to explain it, but then it moves up and down. So like your knee bends and straightens a little bit. And so it's like passive motion. But now they're finding that it doesn't really like help a lot of people, actually kind of like does the opposite. So some surgeons use it, some do. Mine's a little old school, so he decided to use it. His assistant surgeon was like, I don't care for it, but whatever. He listened to the main guy. But yeah, I did try it out for a little bit. It didn't really work for me. So I noticed that it was actually causing like unalignment in my lower back and like my hip and stuff like that. So for me, like I'm not going to go too much into mine because I want to talk about yours. But like regular physical therapy was too rough for me. Like they were pushing it, and like I don't know about you, but did you find that like the recovery and like the rehab was kind of more difficult because you had rheumatoid arthritis? Like, did you have to skip your medicine for a month, restart it? Did you find like just it was just overall like harder to recover from? What do you think?
I think for me, that's one thing I was happy about. Because at the time, prednisone was the only thing that was working for me to be able to walk because of my knee. So I had to stop the prednisone. I want to say maybe 2 weeks before surgery. And the whole time while I was recovering, I could not take my prednisone. And honestly, I wasn't only pain I had was my knee. But it wasn't bad at all. It was just trying to get that stiffness out.
Yeah, I didn't feel bad either. Like I for that month I was off my methotrexate, I felt pretty good. And they started me on prednisone afterwards. I was never on like a daily dose of prednisone before the surgery. It was just after, which my surgeon didn't really like. But I mean, I had to control the inflammation somehow. So
Right.
but yeah, I mean, did you like so I ended up seeing like a functional manual therapist where they kind of work with the whole body. I know some states don't have it, but my rheumatologist who sent me to see a surgeon in first place told me about it when he kind of saw that like after 5-6 months, I wasn't really getting their range. For me, it was like a lot of scar tissue buildup. So my bending is not like as perfect as the other knee. Do you have that issue? Like, is your knee fully bending, straining? Like, how is it going for you? Like, and how long has it been?
It's been, I got it done on January 2017. It's like 5 years.
Oh, okay. So we're same. Yeah. Okay.
Yeah, 5 years. But it doesn't, to other people, I have full range of motion. Yeah. For me, when I compare myself to other people who have replacements, they can do stuff that I can't do. And I'm like, I can't do that.
Yeah.
So I don't think I have full range of motion, but they say that I do. So honestly, I have no idea.
Yeah, yeah. No, I mean, for me, my leg is straight. I can walk now, but the bending is like just the scar tissue. I built up a lot of scar tissue. I actually had to have a manipulation 6 weeks out because it wasn't. Yeah. Did you have to do that too?
Oh, and that's one thing they told me in the beginning. They was like, I have to keep bending it because of my scar. I'm starting, I guess the way I was holding it, or I want to say babysitting it.
Yeah.
My scar tissue was healing that way.
Right.
And so the therapy, she had to like push my knee down to kind of like break it up some.
Yeah.
So she was like, if not, you have to go back and get surgery. I'm like, oh, push it down then, because I'm not doing this again.
Yeah. And then after that, I saw that special therapist and she was like, I have had all my patients avoid a manipulation. But again, I didn't see her in time, but you know, it is what it is. So, I mean, who knows? I mean, do you like, do they tell you eventually, like, you'll have to get another one? Like, I know like some people are like, oh, I got mine redone so quick, but others like it lasts like 30 years, 20 years. So I hope that's the case for me and you, but I mean, yeah. Oh, go ahead.
Differently. And that's a little bit of why I do regret getting it so young. Because I was told that they only last 15 years. And they say you can push it to 20, but 15 years is like the lifespan. And I was told, I don't know if you were told the same thing, but you can only get 3 in a lifespan. So I feel like I'll still be considered young for my third one. So when those 15, 20 years is up, it's like, what happens? Because I did get my replacement so young.
Yeah, I heard different things. I heard people like it lasts like up to 30 years, but also it depends what you do with it, they said. Like if you're running or you know what I mean? Like some people's wears out faster depending on the activities they do too, like some people are really active, like they're running or I don't know what they do, but like it depends like how you treat the knee too and like how, you know what I'm saying? So that's what they told me too. There's a lot of factors, I guess, and how it lasts. But hopefully they come up with something newer, for us. But I mean, it's like quality of life, it's like, I guess they call this surgery an elective procedure. It's like your choice. You can live with the pain or a lack of mobility, but I feel like they should educate people more on like what it could be like if they were to get it too, So I guess there's like pros and cons, right, to the procedure.
Mhm.
I mean, so you didn't really have that many setbacks and challenges then. You had a pretty smooth sailing um
I
recovery, it seems like.
I feel like my only challenge was mentally slash emotionally. I did fall into like a small state of depression, only because the person I am, I'm more on the independent side of the scale, and needing someone 24/7 to help walk that every hour. I need food, I need drink, I need to go to use the restroom. Help me turn over on the bed. So for me, needing someone, I felt like I was a burden to my family. And so that to me, that really bothered me, because it's like, okay, they can be doing all this stuff other than helping me, but they keep choosing to help me. So to me, I really felt bad about that. So I kind of felt like I fell into depression for a couple of months. So that was my setback as far as my knee replacement.
Okay. Yeah, that's interesting. So how did you kind of cope and overcome that phase? Or I mean, I don't know if that's kind of like the word to use, but how did you kind of get out of that?
It sounds crazy, but I listened to, I'm not sure if you heard the song Under Day, Rise Up. I listened to that song maybe 30, 40 times a day for about a year or a little over a year. And that song is really what pushed me through. Other than that, I don't know if I would have made it out of it.
Oh, wow. That's
Yeah.
awesome. And yeah, like they say, like RA and chronic illness impacts us physically, but obviously, same thing with surgeries, but also impacts us mentally and emotionally. I know I kind of was a little depressed too at one point because I like to go out and do things and like just, like there were so many other setbacks with RA that like I missed out on things. So I was like, oh, this is just another thing now. So it was kind of like a long time of solitude from going to like not having even broken a bone or sprained anything growing up for like 18 years. It's like a bit jarring to the soul when all of a sudden you have to do like a 180, 360 and like have this procedure. Do you know what I'm saying? So like I've never experienced like having surgery. So that was like my
Right.
first surgery. And that was like really traumatizing. So I don't know. I think like everyone who goes through this has some type of like depressive episode, like mental and emotional effect, and like post-traumatic stress a little bit too, because it is a trauma to the body, but also mentally, in the mind. So that's kind of like what I went through a little bit. But going back to like how like you exude such confidence and stuff, like did you like have a problem with that at first? Like when you wanted to like wear an outfit or your scar was showing, like how did you come to do that? I guess that's my question.
Honestly, I didn't have a problem at all showing my scar. I did think my scar was ugly compared to other people. Like I kept comparing my scar, my process to other people, because I just thought my scar was just so thick and big, and everybody else is so thin and slim. And it's like, why doesn't mine look like that? But I didn't have a problem showing it. I mean, hey, it's here.
Yeah.
It's gonna be here forever, so show it off. And then I also feel like it's a conversation starter for me. So every time someone sees my scar, which I do tell a couple of fibs here and there, they're always like, "Oh goodness, what happened?" And I'm like, "Oh, I fell off of a dirt bike. Oh, I was ice." Always crazy stories that I always tell about my knee. And then at the end, I'm like, I have surgery. I had a replacement. And it was like, oh man, it was like you should keep the cool stories. Like those are entertaining. But I didn't have a problem showing my scar or the confidence with that at all.
Yeah, I think for me it was like more like I don't know if you had this problem, but like muscle loss, like in the area, like the quad. For me, that was kind of like where I was more like not insecure, but like I was not comfortable showing like my leg wearing skirts or shorts at first because it was like my right leg was like obviously a lot thinner than like the other. You know what I mean? So I was like, I don't know about this. So did you
Yeah,
have that too?
I did. And that's why I only kind of wore dresses
Okay.
because of that same issue. I don't know why I thought I was the only person that dealt with the muscle loss, because my one thigh was like rounded and the other one was just like so thin. And it's like, whew, Raven. So yeah, I thought I was the only person that dealt with the muscle loss.
Yeah, no, I think the quad is like a big muscle that gets thinner because like you're not able to like use the full range. Like I know
Yeah.
for me, like that it was obvious it would happen because my knee was not straining. And so like, you know, those muscles are used when you do those movements and you can't move them, then you know what happens, you know. And then like, yeah, I just wanted to ask a couple other things, but let's see here. I had written them down so I don't forget. Like, I guess like, is there one thing you learned about yourself after this whole situation of having this surgery? Because it's one thing to be diagnosed with something, but it's another thing to have to go through like physical deformities or like surgery to correct those. You know what I mean? So, did you like find that you got more like strength within yourself? Like, I don't know, you know, what is there anything? Maybe there's not.
Mine was to appreciate myself, like appreciate my body, appreciate my abilities, because I'm not gonna say I took it for granted, but you just don't think about what you were doing 15 years ago before this surgery versus the surgery. So it was more of to really just take care of your body, because now it's like, Raven, you only have this one body for this entire lifetime. You have to heal it, you have to nurture it, and you have to protect it at all costs. So now I'm just trying to make sure I'm doing everything I need to do, just so it can heal properly and I don't have to go through those surgeries anymore.
I mean, do you have any like other joints that may need surgery or are you kind of like good?
I had a decorative vein release surgery in my wrist. I need another knee replacement for my left knee,
Oh,
but
really? Okay.
yeah, currently avoiding that. They want to fuse my left and my right wrist. So it's a lot of surgeries they want to do on me, but at this moment, I'm like,
Yeah.
I can't. I can't. I just feel like if I were older, then maybe, because I'm only 30. I need my wrist. So they were telling me if I get it fused, I won't be able to move it. And if I get another knee replacement, I'm just like, to me, just a lot. It's just a lot. And I'm not sure if I'm mentally ready to go through all of that right now.
Yeah, no, I hear you. Like for my elbow, I probably will need a replacement there because that this has been a like a long standing issue from like 2007, but eventually got worse. But that's like something I'm holding off. I remember I saw a surgeon downtown here where I live, and he was just like, stay away from me as long as you can. I'm like, okay, I will. You know, if you don't have pain, I mean, obviously it's like limited motion, but I mean, I'm kind of like you where I'm not like totally ready for that, you know, and if it has to happen, it will. But I think like yeah, I'm just kind of like waiting it out. Yeah. So and
Um,
like for my wrist too, I guess my right wrist, it's naturally fused. So I can't move it. But that was like something that started up when I was like maybe like 3, 4 years before I was diagnosed. I started having like symptoms there. We didn't know what it was, but I was a teenager. So that's been a long standing issue too. So I just want to make sure like people who are watching or listening, like these things didn't just happen overnight. A lot of the times these are like, you know, things that have been going on for years for a lot of people who deal with these things. I don't know if that was for you too. You know, did your like wrist stuff and your knee stuff kind of come gradually or did it happen pretty fast? I know for me, like with my knee, I had damage, but it was very, very mild. But then a flare kind of led me to have like that downward spiral, you know, over the years. So,
Same here. So it was okay. Oh, you're in pain. It's inflamed. Oh, you have a Baker's cyst. Everything is fine. Then it's like, okay, it's getting worse. Get another X-ray. Okay, everything still looks good, but it's like I can't walk. I need more prednisone, so something is going on. And then it's like, oh, the next week you're bone to bone. So it was like I went from here to here and like this. So I feel like to me that happens for every joint in my body. So maybe a month ago, everything is fine. And now we're here and it's like, oh, you need surgery. So it's like, how did this happen so fast?
and I think that's also like the mental and emotional impact that people can find themselves having because it's like so like sudden a lot of things. And you're like
Mm-hmm.
kind of and it changes and you're like, oh well now you have to accept and cope with that part now.
Right.
You know, I'm like, oh geez. But you know, you said a Baker cyst. So like did you have swelling in the back of your knee or like was it where was it?
So I had it for my replacement knee. It was stiff, and then it was like a big lump in the back of my knee. And it's crazy because I was pushing it and I'm like, what is going on? And I felt it drop to my calf. And then I went to my doctor immediately. She's like, oh, that's the Baker cyst. Don't touch it. Make sure you monitor it so it doesn't burst into your leg. And that's where that happened. And it's crazy because now I have a Baker cyst in my left knee, and everything that my right knee did before my replacement, my left knee is mimicking the exact motions.
Mm. Yeah, I mean, like, well, they say RA can be like symmetrical, it can affect, right, both sides of the body. I'm mentioning the Baker cyst because I actually had swelling in the back of my knee last summer during when the pandemic was kind of raging. And my rheumatologist put me on like 10 milligrams of prednisone for 1 week and then 5 because I was trying to wean off. I've weaned off now, but for that 2-week period, that helped. But I just want to say that I had that problem, and I see an osteopath. They're kind of like a chiropractor, but kind of not. They're more gentle, and he did some type of manipulation, and it went away.
Oh,
So look into like seeing an osteopath in your area if there is one, because they can do he did some, I don't know, magical adjustment. I don't even know what it was, but God bless him because he's helped me so much. But yeah, I told him, I'm like, I have swelling in the back of my knee. I've been slathering on Voltaren gel and like popping the prednisone. I'm like, I don't know what to do because, they were saying eventually if it kind of like continues, my rheumatologist, like the surgeon will have to deal with that. So yeah, look into that because it's happened. It's tried coming back. And then when I've seen him, he's made it go away. So.
Oh yeah, I definitely will look at that.
Yeah.
Thank you.
Yeah, no problem. So yeah, I think there may be other people who go through that too, but I was just like, I don't know I'm like, why is this happening on my surgical knee out of all knees? You know what I mean? Like, can it just happen on my good knee at least? Because it's like, it's scary when it happens on something you had a procedure on,
Mm-hmm.
So I don't know. But and then I guess like, was there anything like, I think you may have touched on this already, but is there anything you wish you were told before or after that you weren't told?
I was told before to speak with the herbalist. Just look at natural ways to reduce the symptoms or the pain instead of just jumping straight into it. And I wish someone would have told me to really just do my research, because now I don't regret my knee replacement, but the pain that I had for me to get my replacement, I'm having that pain again in my knee. So now it's like, what was the purpose? So why did I have my replacement if this pain is back? The swelling is back, the stiffness is back. I can barely move it. So now I'm just trying to figure out what was the purpose of this knee replacement.
Does your rheumatologist think maybe you have to switch medicines or something? Or like, is it because of maybe that type of deal or?
That's a whole conversation. Because I've been going to her maybe every other week trying to figure out what's going on. And she sent me to get my eyes and everything. But to me, she's just very nonchalant about the situation. Oh, just take your prednisone and we'll figure something out. So to me, she's not giving me the answers that I need.
Right.
So I'm trying to figure out, what do I do? We got an MRI on it, but it keeps saying nothing is going on. Everything is fine, but it's painful. It's painful.
I'm sorry. I hope you feel a little bit relief soon, But yeah, I know, definitely check out the osteopath stuff because I know I was having pain and sometimes it was coming from like my back or something. I don't know, but who knows what it is. But I hope you find an answer because I know sometimes rheumatologists, they don't have answers. I know I'm trying to find out some answers from my own doctor and she's like, yeah, well, we don't know yet. So I'm like, okay, but I know it can be frustrating. So
Yeah.
I mean, I guess if like you like, because for me, like I would go on like Facebook groups and support groups and try to like talk to people or like whatever. If like anyone's watching right now, like when I post this, is there any like words of encouragement for others or like advice that you would want to leave people with?
I'm just saying about the whole situation. Having a chronic illness can be very depressing. To make sure you just stay positive in everything that you do, kill those negative thoughts with positive thoughts, and then everything great will just come about. Everything great will happen around you. So just stay positive. And I know it's hard to say it because we have those moments when we just want to just break down and cry and just be like, why is this happening to me? Like, what is going on? So yeah, I just say stay positive.
I mean, did you have a good support network with like friends and family, or did you like kind of just like how did like people in your life kind of like help you out too at all? You know? Or-
They were very supportive, but I feel as if you don't have a chronic illness, you can't fully understand what we're going through. So of course they're here for me. If I need any assistance, hey, what you need? But it's like I don't think they fully understand what I'm going through. So it's like you can tell to me, they can say one thing, but their facial expressions will say another. So I don't think they fully are aware of what I'm going through, but they're very, very supportive. Um, they're very, very supportive. I'll just
That,
leave it there.
that's good. Yeah, yeah. Because there's some people out there who don't even have like that support and they go through this all on their own, you know? Because when I was in the rheumatoid arthritis support groups, there was a lot of people who are saying, like, oh, this and this and this person was not really supportive of me or like not helpful. So I guess like trying to get a support system, even if it's not like from those closest to you, can be helpful too, you know? So
Mm-hmm.
everyone just has to find their own way, I guess, in regards to like how they heal, how they find support, and how they kind of you have to find your own willpower too, right? Like everyone can be there for you, but if you have to put in the work too, you know, to kind of get yourself, you know, better and any out of any negative headspace you may be in. So, and I know
Right.
you said you did that listening to that song. What was that song again? I forgot.
Called Rise Up by Andre Day. You should
Okay.
check it
All
out.
right, cool. All right. Well, is there anything else you want to share? Because I think we covered everything, but I mean, if anyone's ever had a knee replacement or joint surgery, comment below, let us know. If you relate to anything that we said, or if you differ, let us know too. But I think, you know, that's about it, Raven. But if you have anything else you want to share, let me know or
I
let
do
us know.
appreciate having me on here. So thank you for having me.
Yeah, no problem. Thanks for coming on.